Each year, 100 million animals are killed due to animal testing. Is all of this worth it? Animal testing is an extremely cruel and inhumane act. According to Humane Society International, animals used in experiments are commonly subjected to force feeding, forced inhalation, food and water deprivation, prolonged periods of physical restraint, the infliction of burns and other wounds to study the healing process, the infliction of pain to study its effects and remedies, and killing by carbon dioxide asphyxiation, neck breaking, decapitation, or other means. Animals experience this cruelty often without anesthesia for relief. The U.S. Department of Agriculture, USDA, reported in 2010 that 97,123 animals were not given anesthesia. The Animal Welfare Act is meant to protect animals and regulate testing. However, it doesn't cover 95% of the animals being tested. The Drea's eye test, used by cosmetic companies to evaluate irritation caused by shampoos and other products, involves rabbits being incapacitated in stocks with their eyelids held open by clips, sometimes for multiple days, so they cannot blink away the products being tested. The Animal Welfare Act, the AWA, does not cover rats, mice, fish, and birds, which comprise around 95% of animals used in research. The AWA covers 1,134,693 animals used for testing in fiscal year 2010, which leaves around 25 million other animals that are not covered. These animals are especially vulnerable to mistreatments and abuse without the protection of the AWA. We see an example of this unmonitored abuse in a primate research house in Minnesota. Some of these primates housed at the NRIC were suffering such severe psychological stress they were engaging in self-mutilation, quoting, tearing gaping wounds into their arms and legs. Video footage shows infant chimps screaming as they are forcibly removed from their mothers, infant primates awake and alert during painful experiments, and chimpanzees being intimidated and shot with dart guns. Not only is animal testing cruel, it is unreliable and unsafe. Some tested products are dangerous for humans, but would appear completely safe when tested on animals. This can also go the other way around, with testing showing that a drug is dangerous when really it can have benefits for humans. In fact, 94% of drugs that pass animal tests fail in human clinical trials. The 1950s sleeping pill thalidomide, which caused 10,000 babies to be born with severe deformities, was tested on animals prior to its commercial release. Animal tests on the arthritis drug Vioxx show that it is a protective effect on the hearts of mice. Yet the drug went on to cause more than 27,000 heart attacks and sudden cardiac deaths before being pulled from the market. Aspirin, for example, is dangerous for some animal species, and FK506 tacrolimus, used to lower the risk of organ transplant rejection, was almost shelved because of the animal test results, according to neurologist Ayesha Akhtar.
Animals and people are biologically very different from each other. That is painfully obvious. Animals at the beginning of the experiment are usually healthy, and they are made ill. They are given a disease or they are injured by artificial means, and that in no way resembles the natural history or the natural course of the disease in people that researchers are trying to mimic in animals. We have chimpanzees. Well, indeed, we share about 98.4% of our DNA with chimpanzees. That tiny difference in the DNA between humans and chimpanzees is huge in terms of biological effects, because chimpanzees are immune to at least 3 deadly human diseases, including HIV/AIDS, hepatitis B, and common malaria. Now, those 3 diseases kill millions of people every year. The chimpanzee is immune to those diseases.
Just as Dr. Derek Smith was explaining, a small difference in the DNA between humans and other primates can make a big difference. Although at least 85 HIV/AIDS vaccines have been successful in non-human primate studies as of 2015, everyone has failed to protect humans. There are countless other safe, cheap, and more reliable options to test products. These include vitro testing using artificial skin, microdosing, and computer models. To start, in vitro is the study of cell cultures in a petri dish. It can produce more relevant results than animal testing because human cells are being used instead of animal cells. Additionally, artificial human skin is another good option. Commercially available products Epiderm and Thincer is made from sheets of human skin cells grown in test tubes or plastic wells and can produce more useful results than testing chemicals on animal skin. Microdosing is the administration of doses too small to cause adverse reactions. It can be used in human volunteers whose blood is then analyzed. Lastly, there are computer models, virtual reconstructions of human molecular structures that can predict the toxicity of substances without invasive experiments on animals.
I'm Brett Johnson. I am a veterinarian and I work at Northwest Animal Care Hospital here in Everett, Washington.
Do you have an opinion on animal testing, like negative or positive about it?
Well, I think that there's an evolution of bringing products out into the market that are safe for people.
So you would like it to continue? Yeah, like animal testing to continue, yes?
If there's a better way, absolutely not. I mean, if we can avoid having to test things on people, on animals, that would be a much better way.
A common assumption that people make about animal testing is that it is in use because it is cheaper than human options and also is necessary to provide safe products to us. However, if we really look into price and reliability, there are far cheaper options that also do a much better job of protecting humans. Those options include in vitro or in-glass testing as well as testing on replica human skin. Both of these other options are far cheaper than utilizing live animals and also have a much higher rate of reliability, which is not hard to beat, as we see the various mistakes in animal testing creates, such as HIV and AIDS medical failures. You can help end the use of animals in product testing by being cautious in your purchases. Make sure the companies you buy products from do not participate in animal testing. There's an organization called the Leaping Bunny that marks products as officially cruelty-free. Either look for this label on products or look online to see if your favorite brands are certified. Together, we can make the world a better place for not only these poor animals who are suffering, but for us as well. Finding more reliable testing options benefits us both.